Good evening. I'm Lori Matthews, and I am thrilled to be the newest professional here at Barkman Smith Physical Therapy. Tonight, we're going to look at things from a different perspective. Why a different perspective? Because I'm not a physical therapist. I'm an occupational therapist. Now, why would Barkman Smith hire an occupational therapist in a physical therapy clinic? Quite simply, to add another layer of services to our patients and expand what we can offer. So, a little bit about me personally. I've been an occupational therapist for more than 30 years. I graduated from Texas Women's University. This was way back in the day before we had computers and Facebook and all of this wonderful stuff here. In my life outside of Barkman Smith, I'm married to my wonderful husband, Kevin, and between us, we have 5 kids and 9 grandkids. Now, I know what you're thinking, Lori, you're too young to have 9 grandkids, and you're absolutely right, but we enjoy them anyway. Professionally, I hold multiple advanced certifications. I am certified in kinesiotape, instrument-assisted soft tissue mobilization. I recently got training for blood flow restricted therapy. I have neurodevelopmental treatment certification. I think there are some others, but I think I copied, how could I forget? LSVT Big, which is a neuroplasticity-driven program to help patients with Parkinson's disease as well as other neurological disorders. So, hang in here with me for a few minutes and I'm going to explain to you how occupational therapy can help you.
What is occupational therapy? As defined by the American Occupational Therapy Association, it is a healthcare profession
To help persons with an injury, an illness, or a disability
that prevents them from doing the things that they need to do in their everyday lives. In other words, their occupations. Think of occupational therapy as skills for the job of life. Now,
I know that's pretty broad.
I'm going to narrow it down for you a little bit. The things that makes occupational therapy special and unique is that we take a holistic
Approach to treating our patients. We take into consideration
the things that are important to
you.
what do you need to be able to do to get through your everyday life. And it could be job related, or it could be your job as
A caregiver, as a parent,
as a
student. Healthcare professions, occupational therapists undergo extensive training.
current university students will graduate with a master's degree.
At the bare minimum,
You can also earn a doctorate.
in occupational therapy.
And like physical therapists, we must renew our license.
Since every 2 years,
And in that 2-year period, we must get 24 hours of continuing education to keep our skill set fresh and current.
personally,
I'm a continuing ed junkie, and I think when I renew my license
next month, I'll have about 40 hours. I can never stop learning
because learning enriches my patients. Professionals, occupational therapists can specialize in pretty much any population. We work in hospitals, we work in schools, we can work in skilled nursing facilities, we can even work in prisons, and best case scenario, we work in an outpatient therapy clinic like Barkman Smith Physical Therapy. Work under the direction of your physician. It can be as easy as getting one of our prescription
pads and having your doctor fill it out and return it to us.
there.
The process is pretty much identical as
Getting physical therapy services. You will come in, I will meet with you, we will do an initial evaluation. I will find out what's important to you. I'll do a thorough assessment of the
deficits or problems that you're experiencing.
and together we'll come up with a plan of care to help you
Reach your goals,
either
if it's being pain-free or restoring function,
or minimizing
a problem that you're having.
That's
what I'm here for.
How is occupational
Therapy, different from physical therapy.
In the very simplest terms,
If we divide the body,
the physical therapist is going to look more at gross motor, large
movement,
The physical therapist is going to look more at
the lower body,
They are the experts at hips,
knees, ankles, low back. Occupational therapy, generally speaking, is going to look more at fine motor skills, more upper body stuff, wrist, hand, shoulder, and how it all ties into your self-care, being able to take care of yourself and do your activities of daily living. But at the end of the day, we are more alike than we are different. There's a lot of crossover, as you can see here. Both physical therapists and occupational therapists can address balance, neurological disorders, neck and shoulder disorders, and general strength and deconditioning. So like I said, we're a lot more alike than we are different, and it all comes down to the particular skill set and interest of your therapist. It's like choosing any other healthcare professional. They're not all created equal. They don't all have the exact same skill set. Your orthopedic doctor doesn't have the same skill set as your neurological doctor, but they're both doctors. Same thing with physical and occupational therapy. We're all therapists, but we have slightly different skill set. An injury like a hip fracture. Chances are you would see the physical therapist to help rehabilitate that hip, get your strength and your balance back, get that hip working properly. If, for instance, you had a hand injury and you had to have some hand surgery, chances are you would see the occupational therapist. If you were unfortunate enough to suffer a stroke and you had weakness on one side of your body, there's a very good chance you would see both of us, physical and occupational therapy. The physical therapist might address your generalized weakness, help you learn to walk better, regain your strength in your lower body. The occupational therapist may address the weakness in your hand and help you relearn things like being able to use your cell phone or to type or to manage the steering wheel on your car. You would benefit from both of us in that case. As part of my holistic approach, I would also assess to see if any adaptive equipment would be of benefit to you. And by adaptive equipment, I'm talking about things such as a long-handled grabber. You may have seen those that, they've got the squeezy handle and they pick up things that you can't reach. Or perhaps an aid to help you put on your socks or your shoes, or perhaps a specialized toilet seat to help you better get up and down off of the commode. Also, as part of my holistic approach, and this is a personal passion of mine, is taking a look at your nutrition and helping you make the best food choices to support your rehab and recovery efforts. Lynn was a 68-year-old lady who fell off her bike during a training ride, and she sustained a shoulder fracture. She came in with orders that said PTOT, evaluate and treat. So which one of us gets to treat Lynn and rehabilitate her shoulder? That depends on a number of factors. It could come down to her insurance. It could come down to if she's already used some of her insurance benefits for physical therapy. She may be more appropriate to be seen by me for occupational therapy to rehabilitate that shoulder. It could come down to who has the most availability on their schedule and can get Lynn seen and treated and taken care of in the most timely manner. So there are a lot of factors behind the scenes that would go into that decision. Another example is John. John was a 72-year-old gentleman who was out walking his dog, and the dog went to lunge after a squirrel. When the dog lunged, John fell, broke his hip. So John came in with orders for therapy. This case could get really interesting. Depending on John's insurance, it's possible that he be treated by both of us at the same time. The physical therapist may help John rehabilitate that broken hip, regain the strength and function and range of motion at that hip. Looking at it from a different perspective, and no, I don't treat my patients lying upside down, but looking at it from a different perspective, I would look at John and say, but if his functional balance was good, that dog would not have pulled him over. So I may request to see John and work on his functional balance, because after all, he can't be out walking his dog if his balance doesn't support it. So there are lots of scenarios and lots of possibilities for both physical and so personally,
My two loves in the clinic are working on shoulders and working on functional balance. Functional balance to me means when you're in the kitchen and you go to reach up for something out of the cupboard and bring it down to the countertop level, that you have the balance to support that. Or when you're unloading the dishwasher and you're changing from a low surface to a higher surface, or a low surface to way up in the cupboard, that you have the balance to support that. Or when you're in the kitchen and you're stirring the pot on the stove and the kids are making a racket in the background and you have to make a sudden quick turn. As I like to say, how well can you do your self-care if you're falling down in the bathroom? So, I think I've covered most of the highlights. If I can be of service to you, please don't hesitate to contact Barkman Smith or contact your physician. I would love the opportunity to help. And I thank you so much for tuning in with me tonight. If anybody has any questions, please put them in the feed there and my handsome assistant Chaz will forward them to me.
So one question is, so occupational therapy isn't just for work and occupations. I know that's something that we hear often. Why do I need occupational therapy? I already work and I'm back to work. So they got a question related to that.
That's a great question. I'm glad that came up because I meant to cover it earlier. Number one, occupational therapists don't find people jobs. Like I said earlier, think of occupational therapy as skills for the job of life. It is a healthcare profession. It is not vocational education or job training or finding somebody a job. It's your daily occupations of, can you get yourself up? Can you get yourself dressed? Can you maintain your balance when the dog lunges and pulls on you in the yard? All of those things are jobs, basically jobs in the day of a life, so to speak.
So what is your favorite body part or injury to treat?
Oh, I don't like any injuries, but I love working on shoulders. That's probably my number one. I also really enjoy working on necks. If we take a look at the structure of the shoulder and of the neck, so many muscles attached to both that I really can't separate them. If somebody comes in with a frozen shoulder or a rotator cuff injury, I'm going to look at their neck range of motion and assess them for neck pain and dysfunction as well. The shoulder, hands down, is my favorite. It's so complicated. It's not just one joint, it's actually three. There are so many muscles involved. You've got the scapula that has to function. In addition to just this glenohumeral joint, you've got the acromioclavicular joint. It's like putting together a puzzle every time I get a new shoulder.
So we did have a comment from Char that she would like to talk to you about balance. So if we have somebody that's interested in occupational therapy, what's the best route for them to take in order to come and see you?
That's a really good question, Char. Depending on how recently you've seen your physician, it may be as easy as calling your doctor's office and saying, hey, I'm fearful of falling, or I've had a couple of close calls. Can I please have orders for occupational therapy and send them here? That's one possible scenario. If you haven't seen your physician in a while, they may require you to come in. God bless you. They may require you to come in before they will sign the orders for therapy. Or if you have a good relationship with your doctor, it might also be possible for us to just fax over one of our prescription pads and say, the patient has called and requested services with our clinic. May we please have orders? And most of the time they'll fax them back to us. That's a great question.
Well, we did have a comment from somebody that you might know. So Kevin made a comment that you have fixed his shoulder multiple times. I assume you know Kevin very well.
I do know Kevin very well, and yes, I have fixed his shoulder multiple times. If he'd stop injuring it.
We had a question, why did you pursue occupational therapy as a career?
This goes way back, way back. I started out as a therapy aide at a senior center near Niagara Falls, New York. And I got to know the occupational therapist there. I saw what she was doing and I really liked it. Now granted, it's a very different version of occupational therapy than what I practice now. We're talking 35 years ago. And she was also the highest paid person on staff. So, gotta admit, we all need to make a living. So, good questions.
All right, one of our other questions. So this requires a change in camera panning.
Uh-oh.
All right, where did you get those shoes?
Woo! You like these?
I don't know if everybody can see those, but those are quite the shoes.
You like my blingy shoes? Colin, I got these shoes at DSW Shoe Warehouse.
You're so busted.
Is certification for occupational therapists the same in all states? I imagine like the licensing requirements.
The licensure requirements are the same, and most states now have a reciprocal agreement. So if you're licensed in one state, it's a fairly seamless process to get your license in another.
Questions, comments?
How has your transition to Barkman Smith been from your previous?
Woohoo! Need I say more? It's been fantastic. The team here is second to none.
They've gone out of their way to be kind
And helpful,
help me learn their system.
which is different than anything I've used. So, nope, it's been amazing.
We had a few comments from some of them. I think were previous employees and previous patients. That it's exciting to see the expansion of Barkman Smith Physical Therapy.
It
to
is
include
exciting.
Occupational therapy into
Yeah.
The services that they offer. One of those from Brad, who was a longtime technician of ours.
Cool. Keep them coming.
What's the farthest that you've traveled to treat a patient?
Oh gosh.
That's a plant question? Like maybe
Oh.
somebody knows you've gone pretty far?
Oh gosh. Well, many years ago, I worked home health, so I was all over the place. Wise County, Montague County. I think I even Parker County. Yeah, but if you want to see me now, you got to come here.
I think we might be through all the questions.
All right.
What is the greatest lesson you've learned being an occupational therapist so far?
Listen to my patients. Listen to my patients. That one's easy.
Beautiful. Get to know your therapist. Dr. Peter Lamb will be doing a Facebook Live, so get to know your therapist is the next one.
Okay, for those of you who couldn't quite hear Chaz, tune in a couple of weeks. Dr. Peter Lamb, physical therapist, will be, yes, Dr. Peter Lamb, will be featured in Get to Know Your Therapist. So tune in to see Peter. All right.
It'll be November the 10th.
November the 10th at 7:15. Come join us. So if that's all the questions, I want to thank you all so much for tuning in. I am so grateful for the love and support I've gotten in this transition to Barkman Smith Physical Therapy, and I'm thrilled beyond measure to be the first OT here and to be incubating our little program. So thank you so much. God bless. Have a wonderful night.